Back to my channel Mis.Medicine. In this video we will discuss about hypertension drugs, antihypertensive drugs. If you are new here, subscribe to the channel and follow us on Instagram and Facebook. First of all, what is hypertension? Hypertension means increase in blood pressure. Normal blood pressure is 120 systolic blood pressure and less than 180 diastolic blood pressure, means 80 to 120. Pre-hypertension is systolic blood pressure 120 to 139, diastolic blood pressure 80 to 89, means 140. Next, hypertension. Systolic blood pressure more than 140 and diastolic more than 90 to 140. In grade 1 hypertension is in between 140 to 159 and 90 to 99. In grade 2 systolic blood pressure more than 160 and diastolic more than or equal to 100. So these are the stages of blood pressure, hypertension. Now we will discuss about the treatment, how we can treat blood pressure, hypertension. Antihypertensive drugs are, first group of drug is diuretics. It decreases blood volume and it decreases hardness of the blood vessel. It decreases sodium also. In group of drugs are vasodilators. Third group of drug, sympathetic system blockers. And the last one, fourth, is RAS blockers. Or you can remember is like A, C, D. A means AC inhibitors. Or ARBs. C means calcium channel blockers. And D means diuretics. Types of diuretics we will use: loop diuretics and thiazides. Loop diuretics are strong and short acting. Thiazides are weak, long acting, and it used as first line drug of hypertension. Vasodilators include, first, nitric oxide releasers. It include sodium nitroprusside and hydralazine. Both are used in hypertensive emergencies. Sodium nitroprusside side effect is cyanide poisoning. It leads to cyanide poisoning. And its antidote is hydroxycobalamin. And the hydralazine, it leads to acetylation and cause SLE, systemic lupus erythematosus. Next group of drugs are calcium channel blockers. It includes verapamil, diltiazem, DHP, amlodipine, and nicardipine. Potassium channel opener. It includes MDH masala. It's mnemonic. M means minoxidil, D means diazoxide, and H means hydralazine. Minoxidil causes hair growth. It used for alopecia and it avoided in young females. Minoxidil is a prodrug. Itself it is inactive. It must be metabolized to form minoxidil sulfate, which is active form, and activation of minoxidil is a phase of second reaction. And diazoxide, it decreases the release of insulin. It is contraindicated in diabetes mellitus and it is used in insulinoma. Next group of drug system blockers. It includes ganglion blockers, and receptor antagonist. It includes trimethophan, and hexamethonium. It is mainly used as antidote for nicotinic poisoning. Next group of drug in sympathetic system blocker is alpha-2 agonist. It includes clonidine and methyl dopa. Both are safe in pregnancy and both can cause dry mouth and sedation. Clonidine can stop causes rebound hypertension and methyl dopa can cause hemolytic anemia. Group of drug alpha and beta blockers and sympathetic neuron blockers. Sympathetic neuron blockers include metyrosine, rezerpine, and guanethidine. Next and the last group of RAS blockers, which is renin angiotensin aldosterone system. It includes renin inhibitors, drugs are aliskiren, ramikiren, and enalakiren. These are oral drugs. And renin release inhibitors are beta blockers. If you want American guidelines and JNC guideline video, let me know in the comment box. I will upload that video also. Thank you.